Hi everyone, my name is Courtney Leydig, and I am in the traditional BSN program here at Nebraska Methodist College, and this is my final capstone presentation. My public issue is childhood poverty in Omaha, Nebraska. Childhood poverty can create substantial health issues that impact millions of children around the world. Poverty is not only defined by lack of income, but also by the inability to meet basic needs like food, water, shelter, education, and healthcare. Low income is defined as less than 200% of the federal poverty level, and extreme poverty is defined as less than 50% of the federal poverty level. Marital status, education, social class, social status, income level, and geographic location, like urban versus rural, can have major influence on a household's risk of living in poverty. Racial and ethnic minorities are more likely than non-minority groups to experience poverty in their lifetime. Why did I choose this issue? I chose this issue because it's something that I am extremely passionate about, and I wanted to be able to educate as many people as I could regarding this issue in order to spread awareness about it and what can be done to help it. Some facts. Children that are born into poverty are more likely to experience health problems such as poor nutrition, chronic disease, and mental health problems. It's also estimated that families need an income of about twice the federal poverty threshold in order to afford just the basic necessities of food and shelter. This can create hunger and food insecurities, limited access to health care, decent housing, and the need for participation in federal programs like SNAP, TANF, and Medicaid. My personal connection to the issue, I didn't necessarily grow up in poverty, but I've struggled with poverty while at Nebraska Methodist College. I lived paycheck to paycheck and relied on the government to ensure that my son was fed and well taken care of. I just barely scraped the surface of living in poverty, and it's given me so much insight on what areas need to be changed. I have met many women, children, and families who live in poverty day to day and strive to do what I can to help them succeed. My first effective communicator reflection is about me speaking at a food insecurity summit at the College of St. Mary's. I discussed the many experiences that I've had with food insecurity, like not knowing where my next meal was coming from, how I was going to pay to feed my family, and how in the world could I stretch my dollar as far as it could go. As an effective communicator, I felt that since I had experienced this type of situation firsthand, it helped me portray my thoughts and feelings regarding the topic. I was able to use my developing communication skills to capture the audience, and it gave me so much insight to the fact that there are so many people who struggled with food insecurities in their lifetime. I can use the verbal communication, skills that I have learned to speak with my patients and their family members to have a better understanding of their needs. I can also use the nonverbal skills that I've learned to help them feel more comfortable about discussing the needs of their family with me. These communication skills can also be used to give information regarding various topics, both in written form and verbal form, by offering referrals to these helpful resources. My second effective communicator reflection is about me speaking at the Methodist Hospital Foundation. I spoke about the hardships that I have faced before and during my time at Nebraska Methodist College. I talked about the challenges that I had faced with my son when he was born, what it took for me to move to the Omaha area, and the many hardships that I've faced while at Nebraska Methodist College. My goal was for her and the foundation to hear my story and be an advocate for donations to help other students in need. I conveyed my thoughts as an effective communicator in public speaking. I was able to collect the things that I was going to say and discuss the different hardships inside and outside of Nebraska Methodist College that I'd experienced. I was also able to adapt my effective communicator skills to fit the audience to which I was speaking. As a nurse, Full objective assessments are needed to provide additional resources. The nurse should talk with the patient and the family to better understand the needs and provide the necessary consults to ensure that they're set up for success. Also, the nurse needs to ask questions in a variety of ways to be sure that they're understanding the patient and family's needs. The nurse should use observational skills to identify the many resources that the patients might have that they're not sharing. My first reflective individual reflection is about me attending the 2019 National Student Nursing Convention in Salt Lake City, Utah. Each morning started with plenary sessions that touched on various topics in the healthcare system, such as innovative patient care, treatment approaches, and devices that profoundly change healthcare. I also attended focus sessions throughout the time of the convention that discussed malpractice, emergency nursing, and the Nurse Licensure Compact. With this experience, it influenced me to be a reflective individual because I realized a need to engage in continual professional development. In order to do this, my goal was to be the voice of the Methodist Student Nursing Association organization and to help others see the value of professional organizations. Understanding that innovation can come from creating relationships and interdisciplinary connections and practices, I strive to develop resources not just from a nursing perspective. In doing so, I'll look at what other disciplines can offer to those experiencing poverty. It's really helpful to spend ample time in researching what's already being done so that we can improve and strengthen it rather than always trying to recreate something that's already working. My second reflective individual reflection is about my sister's struggle with addiction. My sister struggled with a drug and alcohol addiction ever since she graduated high school. It's taken a huge toll on my parents as well as me and my family. Her most recent arrest occurred 3 days prior to my wedding. This experience helped me learn to be a reflective individual because it gave me a lot of insight on how to look at the entire person and how to be patient and kind because you don't know what people are going through. It gave me insight on how interconnected life really is because her addiction not only affected her, but it also affected everyone else around her, including her family. What I learned through this experience shows me that one issue can affect so many aspects of a person. When a person lacks money, it not only affects food and shelter, but it affects home life, health, education, and many more aspects. To better understand a person holistically, the nurse needs to be able to look at a situation from many perspectives. This allows every aspect of that person to be assessed, which allows more accurate teachings and resources to be given. A survey completed by Community Action of Nebraska found that low motivation is the top perceived cause of poverty in Nebraska. Other top perceived contributors were lack of training or education, drug abuse and addiction, or being a single parent. My first change agent reflection is about lead screening at an OPS elementary school. The lead screenings were done for predominantly Hispanic preschool-aged children at schools that were located within the Omaha Superfund site. If Nebraska Methodist College was not associated with DHHS, these children would not have been tested, and they may not be able to make it into the clinic for another appointment to get tested or to be treated for a previous test. I learned that even being a part of a small change, it can greatly impact a child's well-being. If these children weren't being tested like they were at school, they might never get the critical care that they need, which further increases their chances of childhood or young adulthood health issues. As a nurse, it's really important to advocate for programs and resources that will increase access to these resources and care at an early age in order to minimize barriers to accessing these resources, like the lead screening program that I participated in. I could be a change agent by advocating to offer programs and resources in places where individuals are living in poverty to minimize barriers to access. Another fact, in Omaha, 9% of Caucasian residents, 26.9% of Hispanic residents, 28.9% of Asian residents, and 29.8% of African American residents live below the poverty line. My second change agent reflection is about the COVID-19 pandemic. During the second half of my junior year, the coronavirus hit the world. COVID-19 changed everyone's day-to-day lives due to loss of jobs, decreased hours at work, canceled schools, decreased income, and ultimately getting sick. Nebraska Methodist colleges moved their classes online. I was furloughed from my two jobs, and I had to be my son's school teacher due to his school closing, all within about a week. As a change agent, I learned that change is inevitable. I grew my skills as a learner and a teacher by enhancing my skills in time management, organization, resilience, and hard work. Oftentimes, we think change is a bad thing. With this pandemic, some changes were not all bad. Many jobs might continue to work from home in order to keep their employees, as well as being cognizant of their health. Also, there may be more telehealth options for office visits in order to decrease exposure. Change is difficult to accept sometimes, but it can often lead to better outcomes for the community. Change is often slow and unwelcome, and advocating for change can be extremely frustrating because what our first ideas are on how to fix things might not work. It's important to be accepting of what's happening around the world and to be willing to adapt the ways that we advocate, outreach, and educate in order to meet the needs of our community and more specifically our patients. With COVID-19, some of the ways that we might have done advocacy or outreach are not possible, so we must be able to be innovative to be able to be successful agents of advocacy. It's important to understand that advocating for change is completely necessary. Even small things can make the biggest impact. Poverty can affect everyone, your neighbors, coworkers, classmates, and even your family members. So ensuring that you're doing everything that you can to find proper resources and advocate for change can make a huge difference in their lives. As a student at Nebraska Methodist College, I have developed skills as an educated citizen in the aspects of reflection, effectively communicating, and being an agent of change. As a healthcare provider, these skills are necessary to provide holistic, well-rounded, and high-quality care. I would like to thank all of my amazing instructors, classmates, and the rest of the Nebraska Methodist College faculty that have pushed me to develop my skills as an educated citizen in order to be the best nurse that I can be. Thank you.